Okay, thank you everyone. We are now on live, and Poonam, please start recording, and Peter, thank you. You can start.
Hello. Welcome to the UCL Institute for Risk and Disaster Reduction 10th Annual Conference on the COVID-19 pandemic, a global perspective. I'm Peter Salmons. I'm Director of the IRDR. We welcome you as researchers, students, practitioners, policymakers, the media, and the general public to a day of thought-provoking discussions on how the COVID-19 pandemic is impacting vulnerable groups, communities, and countries, and the necessary changes to emergency management policies and strategies to better manage the current crises and better prepare for the next. Our in-house and guest experts will present a global perspective on the latest research and analysis through talks, interactive discussions, and in conversation. We will explore multidimensional aspects of the crisis, considering their physical, social, economic, environmental, institutional, political, cultural, and gendered dimensions. We've moved the platform to Zoom, so thank you for staying with us at short notice. We found our rendezvous platform could not work for a couple of our guest speakers, so we have moved to Zoom. We still have the Zoom networking meeting function for the tea breaks. So do stay with us for the day. We've got, of course, at 12 o'clock, our keynote speech from Mark Gordon, the UN Office of Disaster Risk Reduction, and at 2 o'clock, we have our In Conversation with the Right Honourable Hilary Benn, MP. So the Institute for Risk and Disaster Reduction, the IRDR, was launched in 2010 with a mission from the Provost to lead transdisciplinary research, teaching, and knowledge exchange in the UK and internationally. We probably had our toughest year. The early days and weeks of the crisis saw some of our students fall seriously ill and an illegal eviction to deal with. Staff struggling with health issues, self-isolating, and on reduced hours with caring commitments. Moving teaching and assessment online over a weekend, with research put on hold and IRDR core appointments and maternity cover frozen, there have been tough times. And along with other UK universities, UCL faces an uncertain year ahead, even though the campus will be open for the start of the 2020 academic year. But with our close involvement with some of the world's most vulnerable people, such as Rohingya refugees, we are only too well aware of the impact of COVID-19 around the world. This year's Humanitarian Summit and IRDR Annual Conference both reflect this, with the former focusing on the COVID-19 and climate crisis or humanitarian crises, and the latter looking at the pandemic from a global perspective. However, so many positive things have happened in this, our 10th year. We've now been established by UCL Council as UCL's newest academic department. We're promoting our new BSc Global Humanitarian Studies program to start in 2021. And we welcome the appointment of 2 lecturers in humanitarian studies, Dr. Poonam Yadav and Dr. Jessica Field. The Centre for Gender and Disaster launched its Global GRIP project. Professor Patty Koskova won IT Innovator of the Year. Research meetings from the Spring Academy to a workshop on identities in education crisis successfully transitioned online. And so it was pleasing to see research not just thriving in the IRDR, but actually striking out in new directions, even during lockdown. And of course, we have our master's program, our MSc Risk Disaster Risk and Disaster Science and Risk Disaster and Resilience, as well as our new MSc programs. So we're going to come out the other side of the coronavirus crisis, a strengthened department, the mission to develop the IRDR and Humanitarian Institute, themed around disaster resilience, cascading crises, natural hazards, humanitarian crisis response, health and emergencies, conflict and migration, climate change adaptation, and gender responsive resilience, in order to integrate education, research, innovation, and enterprise for the long-term benefit of humanity. If our vision appeals to you, we invite you to join with us. You may join the IRDR through our webpage. You may also join us in some of our ongoing COVID-19 research projects, such as our COVID-19 Observatory, or our My Lockdown Journal, or our European-wide perception survey on COVID-19 emergency recovery and improvement. So we look forward to engaging with you, and I do hope you enjoy this one-day conference. Thank you very much. And now I will hand over to Dr. Bayaz Ahmed, who is the convener of the 10th annual conference. Thank you.
Thank you, Peter. Can you hear me? Okay, thank you, everyone. I am Bayaz Ahmed, lecturer at the Institute for Risk and Disaster Reduction at University College London, UCL. I am organizing the conference on behalf of the department. It is a great pleasure for me to declare open the UCL IRDR 10th annual conference. We welcome the participants from all over the world who are joining us remotely to exchange ideas, network, and collaborate on the contemporary and emerging field of the novel coronavirus, in short, COVID-19 pandemic. To begin with the day, our first panel discussion will highlight on the global perspectives on the pandemic. Starting in a few minutes, please note the time displayed in our website represents the British Summer Time BST. At around 12 p.m. today, we will welcome Mark Gordon from UNDRR for the keynote speech. Then after the lunch break at 2 p.m. today, we will be welcoming the Right Honorable Hilary Benn MP for In Conversation with Christopher Gans, who is an award-winning journalist. At 3 p.m., Professor Kumar will be moderating our second panel discussion on COVID-19 and the health of refugees, migrants, and minorities. Our panel discussion 2 is organized by Lancet Migration and UCL Institute for Global Health. At 4:45, we will have our IRDR PhD and MRES Research Showcase moderated by our PhD students, Miles and Shaw. Please note, the event is now being live streamed as well on our IRDR YouTube channel, and you can join anytime here on this platform. No password is required. Please use the Q&A facility here or tag us on Twitter using the hashtag IRDR10. You will find all the details on the conference website. Please remember, this is an online event and our guest speakers are joining from multiple continents. We have different levels of internet, bandwidths, and Wi-Fi connections. There might be some issues, but we'll try our best to resolve any technical difficulties immediately. In that case, please bear with us and have patience. I sincerely hope you will enjoy the day-long interactive discussion, debate, and networking opportunities here. Thank you for your participation. Now, I will hand over to Professor Peter Sammons again, who is the founding director of the UCL Institute for Risk and Disaster Reduction and Professor of Geophysics at UCL. He works at the interface of natural and social sciences, and IRDR is, of course, the brainchild of Professor Peter. Today, Professor Peter will moderate our first panel discussion on global perspective on the COVID-19 pandemic. Thank you, Professor Peter Sammons. The platform is now yours. Please unmute.
Thank you very much, Bias, and I'd like to welcome everybody to our first panel discussion about COVID-19 pandemic from a global perspective. In the media, I think there's been a ghoulish comparison of the international death rates caused by pandemics. These be translated into moral judgments on governments, countries, and people. The UK is judged to have done particularly badly. Death rates amongst the elderly in care homes has been shocking. But ethnic minorities have also been disproportionately impacted. There is an important gender perspective too, as women disproportionately have shouldered caring and homeschooling responsibilities. But there's been little real analysis or international comparison beyond the simplistic headlines. So to open up a proper debate, the IRDR has assembled an international panel with knowledge about the crisis from the UK, Italy, China, Nepal, Bangladesh, and from different disciplinary expertise. So in particular, the panel will be able to review how the pandemic has impacted countries differently around the world, including the UK, Italy, China, Nepal, and Bangladesh, which have all imposed lockdowns to varying degrees, but with different outcomes. But also look at different communities and different genders and how that has also impacted by COVID-19. I think the panel will also try to address, has a command and control disaster management response been effective? How have women been impacted? Is the pandemic a major setback for women's equality? Minorities in the UK have been disproportionately impacted. How have these played out in other countries? And what different approaches have been taken to shielding vulnerable communities and elderly in care homes in particular? So I'd like to introduce the panel. We have Professor David Alexander. David is Professor of Risk and Disaster Reduction at UCL. He teaches emergency planning and management. His books include Natural Disasters, Confronting Catastrophe, Principles of Emergency Planning and Management, Recovery from Disasters. He's a founding editor of the International Journal of Disaster Risk Reduction and Vice President of the Institute of Civil Protection and Emergency Planning. His current research interests include natural hazards, earthquake disasters, and emergency planning and management. He's currently working on a new book on emergency management, a companion to his recent emergency planning volume. Then I'd like to introduce Professor Imtiaz Ahmed, who's a Professor of International Relations and Director of the Center for Genocide Studies at the University of Dhaka. Professor Ahmed was educated at the University of Dhaka, the Australian National University, Carleton University in Canada. He is currently visiting professor at Sargez University in Beirut. He's a recipient of various awards and honors and has authored or co-authored 26 books. His recent publications include the following edited volumes: Genocide and Mass Violence, Politics of Singularity, the Rohingya Refugee Crisis. So very much welcome, Professor Imtiaz Ahmed. We have Dr. Poonam Yadav, who is a lecturer in humanitarian studies and co-director of the IRDR Center for Gender and Disaster. She is the co-investigator for the UKRI Collective Award, Gender Responsive Resilience in Intersectionality in Policy and Practice, a Network Plus Award. And since June, Dr. Poonam Yadav has been a lecturer in humanitarian studies for the new BSc program on global humanitarian studies in the IRDR. She coordinates the module Gender, Disaster and Conflict. Prior to joining UCL, she was a research fellow in the Center for Women and Peace and Security and a teaching fellow in the Department of Gender Studies at the LSE. She completed a PhD from the University of Sydney. So very much another welcome, Poonam. And then I'd like to welcome Dr. Kwai Chang, who is an associate professor in the School of Public Administration at Guangzhou University, China. She is Deputy Director of the Southern China Disaster Research Center. She received her BSc, MSc and PhD in Guangzhou University of Science and Technology. Her PhD focused on building disaster resilience in Chinese urban communities. She held a postdoctoral position at Keio University in Japan, working on post-disaster reconstruction in Fukushima. And she's one of the first foreign scholars to enter the Fukushima radiation contaminated zone after the disaster. She's also conducted research on long-term disaster recovery in Wenchuan, China. Her interests focus on sustainable disaster recovery, disaster preparedness, early warning systems, and community resilience. Her current research is supported by the National Social Science Foundation of China and the National Natural Science Foundation of China. So welcome to all the panelists. What I would now like to do is to ask each of the panelists in turn to make a short presentation of about 6 or 7 minutes. We'll then have a discussion within the panel, and then we will open it up to the floor for discussion. Just say if you want to ask a question, please type your question, or that you want to ask a question, into the chat facility on Zoom, and we will either ask the question to the panel, or else if you actually want to speak yourself, do then put up your hand and we will try and come to you so you can put the question yourself. What we'll do, sort of in the time-honoured way of BBC Question Time, is to collect together a number of questions and then take those questions to the panel, who will then address them. And then we'll go out again for a second round of questions to the panel. So with that as way of introduction, then I'd first like to ask David Alexander to address some of these issues about the COVID-19 global pandemic. David, over to you.
Unmute. Right, thank you, Peter. Hello, everyone, and greetings from Italy. In 2008, I went to a conference and an epidemiologist stood up at it and said, "My job is to tell you something you don't want to know and ask you to spend money you haven't got on something you don't think will happen." He then went on to outline a scenario for a pandemic, which was uncannily like what happened 12 years later. Not that he himself was particularly innovative, in as much as the scenario had been elaborated by a fairly large number of people who published in the scientific press from 2003 until 2009. But what I'm trying to tell you here is that we had a pretty good idea of what was likely to happen rather a long time ago. And one reason why was that the previous episode of sudden acute respiratory syndrome virus, SARS, bearing in mind that COVID-19 is a SARS virus, occurred from 2002 to 2004. It infected 8,000 people in 29 countries and killed 774. It was basically stopped by concerted international action from being rather worse than it could have been. Now, true, the SARS virus of that epoch was actually very lethal, perhaps 5 or more times more lethal than COVID-19, but it was rather slow to disseminate. It was definitely slower than the current SARS. But what it did was to give rise to a period of intense worldwide pandemic planning, which lasted until about 2013. During this, gradually influenza came to be feared more than other viruses. So that really poses a question when we're looking at COVID. is non-seasonal influenza really different from a SARS virus? The answer is yes, in the sense that influenza generally is likely to have a faster rate of infection, and therefore testing is not so important as it is with a SARS. But on the other hand, the answer is no, because the needs generated by the emergency are virtually the same between SARS and influenza. Personal protective equipment, keeping the supply lines going, managing the social and economic problems, and so on and so forth. But COVID-19, what sort of a disaster is it? Well, of course, it's not abrupt. There's no direct physical damage, but there are plenty of casualties. Most disasters are localized or regional, but this one is worldwide. So if we want to give it some kind of a description, let's call it a wave disaster. It ebbs and it flows, it spreads and it dilates. Well, we knew quite a bit about it before it even happened. We knew the basic scenario for a pandemic in full, although we were rather hazy about the recovery phase. We knew that it would have socioeconomic consequences that would be at least as serious as the medical ones, and we knew more or less what they would be. We knew how disruptive they would be and what shifts in patterns of demand and supply and human behavior would take place. So it's remarkable what we did know. Now we come to managing COVID-19. Managed basically on the basis of political decisions which are based upon scientific advice, or at least we hope they are. In many places, emergency planning, however, has been marginalized, ignored, and underfunded. And the result of this is that it has forced scientists, particularly epidemiologists and virologists, into the position of becoming emergency planners and managers. And I would argue that they're not really suited to such roles. Politicians have taken that role as well, but emergency planners in many places have been somewhat sidelined. We knew some things, we didn't know others. We didn't really know how to recover from this pandemic. We certainly didn't know a lot of things about the virus because it's a new and emerging virus, and therefore we have to learn about what it is capable of doing. Therefore, we don't really know how many waves of infection are likely, although we can say at present that at least 4 countries are well into their second wave of infection, and that should be very much an alarm signal to the rest of us. We half knew about the risk to care homes, although that had been somewhat understated in the scenarios that have been constructed, and that unfortunately was very much a fatal error. For example, in Milan, the emptying out of hospitals with patients who had COVID into care homes led one care home alone to have 400 deaths, which is now the subject of an enormous judicial inquiry. Leadership has been very variable worldwide. In places, it's been arrogant and denialist. There isn't a problem. In places, it's been ignorant, failing to consult experts. In places, it's been indecisive or erratic. And in places, it's been negligent, failing to act on imperatives, or exploitative, failing to balance the medical side with the economic imperatives. But there is a lot that could be done, and a lot, of course, that has been done. We needed to recognize the signs and react quickly. We needed to learn quickly from other countries and study the progress of the disease in them in order to learn lessons. Quickly impose strong measures, physical distancing, tracking, tracing, containment, community measures, and that, in fact, is standard epidemiology. And above all, we needed to use scenario-based planning. So what about the present and the future, very briefly? Is COVID-19 going to perpetuate inequality, which has been growing in the world since 1970? Is COVID-19 something in which people have made money by exploiting others? Will the future be greener, and will that happen fast enough? Will there be bigger and worse pandemics? The next pandemic will probably be influenza, and the possible source of it has already been identified. But we have to learn how to live with disease risks, and that really is something that must be done. Certainly because the solutions to the COVID-19 problem are not immediate. But my take-home message is simply this: Emergency planning and management and risk management really hold the key to the control of pandemics, because many of the immediate problems we have to deal with are problems that emergency managers, on the basis of plans, should be able to solve. For example, how to identify needs in time to plan how to satisfy them, how to involve the public and communicate well with the public, how to develop a clear, precise, but flexible strategy that can be adapted to increasing knowledge of the disease and its behavior, a strategy that is sensitive to the evolving needs and situations. So I think we need to build up emergency planning and management. It's never too late to do so. In that respect, we have a report. My last words are, let me see whether I can share this with you through my screen. And perhaps here you can see that we have a report which we've issued. I'll be producing a new version of it very soon because it's an iterative report. If you would like to add anything to it or have comments on it, I would be very pleased to hear them, because this is a cooperative effort on behalf of trying to improve the scenario at the base of making plans for the present and future pandemics. Thank you for listening to me.
Thank you very much, David.
Yeah.
I'd now like to ask Imtiaz Ahmed to start his contribution to this discussion.
David, please stop sharing. Okay, Professor Imtiaz, you have to unmute. Just a moment.
Okay, now I got it. Let me share my PowerPoint. Just give me a second. Can you see that? No.
Yes, yeah.
You can see that?
Yes.
Okay, just give me a second. Okay, just give me a second. No, I lost it. Got it. Okay, you can see that, right?
Yes.
Okay, good morning, good afternoon, good evening to different people in the different places of the world. And thank you, Peter, thank you, Bias. Thanks to UCL for giving me this opportunity. I just have a few slides, 4 or 5 slides to give you a sense of some of the things that I want to flag. Since we have been asked to speak on the global perspective, I'll try to remain at the global perspective. But before that, just to give you a sense that when we talk about global, keep in mind we live in a very complex world, and the method is equally complex. And what I have in front of you is something goes back to South Asian or Indian dialectics. I don't want to go back to the method, but just to give you a sense that when we talk about COVID-19 pandemic, you have all the circles actually. You have the personal, local, national, regional, and at the very outer space, you have the global, and all all are important, and all must synchronize at one point in order for this pandemic, at least to have, at least to contain it, or to be what I would say getting used to it. Now, I'm not going to talk about the other levels. That will take huge time. I'll just keep at the global level and give you a sense where we are and what has happened so far. Now, when the pandemic came, unfortunately, we were a bulk of the major countries, if you take USA, UK, Brazil, even India, Australia, all these were under right-wing governments and very insular governments. More interested in territorializing the understanding of the world, guarding the borders. So when the pandemic came, it did not come at a different time frame. If I think if the liberals were in power or the Democrats in power, I guess things probably would have been very different. But since bulk of them were right-wing governments, the insularity made the pandemic even worse. They didn't believe it to begin with. They were more interested in protecting the borders. I remember, back in February when U.S. government tried to stop Chinese flying to U.S., but allowed all the Americans in China to come back, fly back, and that was open up until March. And it didn't really make sense because a virus would not know who is a Chinese and who's American, and the whole what you call the kind of a scenario really made things bad. And the same case I believe in India also. We have a right-wing government, and that also did not take things seriously in January. They had 1 or 2 months actually to have made a difference, but somehow they did not believe the news that were coming from China, and that was one of the big reasons I think we have this pandemic to such a big extent. It's not like pandemic is unusual. Pandemic has been there earlier also, but one of the big reasons I believe having right-wing governments, I guess the world somehow was very unfortunate. Now, the second one is we have something like, in the post-war democratic capitalism is over, as some people will say, since 2008. So you have pandemic at a time when the gap is huge between the disempowered and the empowered. And then that also made things very difficult and very different for pandemic. And I guess, again, if you give the example of US, you will see that bulk of those who suffered were disempowered. Well, the blacks have suffered more than whites, to give an example. And immediately we saw how racism came to play a part in this pandemic time. So number two is this post-war democratic capitalism that was there for almost 60 years, was no longer there after 2008. So the whole issue of public health was neglected. WHO was not taken seriously by some of the, at least by the US as an important player, and also public health in different countries, got somehow neglected, and that also contributed, to this mess that we have now. The third one is you have the US, China in the middle of a never-ending trade war. So when the pandemic came, they were already in the trade war, and there was a serious trust deficit between these two countries, and that also contributed to trust deficit around the world. And one can see how that trust deficit globally has really made a mess. Now, if you take all these three stories, starting from the first one with the right-wing governments, and then you have this post-war democratic capitalism almost coming to an end, and then you have this US-China, the two big economic giants at loggerheads. You can see that we were in a world which was not really good enough, or in a structure that could have helped otherwise. So somehow one can say it's a bad luck, or some can say it's a configuration which somehow made this pandemic worse. And this is something that we have to keep in mind. Now, my last slide will give you a sense of what is happening and what we can expect. Well, four things. Collective global effort is missing, and one can easily see even in the making of vaccine, there is a rat race. There is some cooperation between some countries, but not a big global effort working together. This probably would have been the best time to have a global vaccine done, with all the brains that the world has. But somehow there's a rat race, and of course that is going to, cost more lives, and it will also cost money. And that is one thing I think we have to keep in mind. The second one is the declining economy of the West, and that is something which I think the developing countries will suffer more than otherwise. Had it happened if the West economy was in high gear, then probably things should have been different. But the pandemic has come at a time when the relationship between the Western developing countries and the Western developed countries and developing countries are not in good shape, and that is also going to impact upon human rights, no doubt about it, on the state of democracy in different parts of the world. So somehow, I think pandemic is going to make it worse. The third one is the re-rise of China. I say re-rise because I'm sure some of you will know that in the 18th century, China was the largest economy in the world. They lost out 19th and 20th century. So 21st century, they have come back. So it's a re-rise. We are yet to know what this re-rise will happen, how it will unfold. But one can see that post-pandemic era would be qualitatively different because of this particular re-rise of China. And this is one thing that we have to keep in mind. And the last one is, at least this is my personal assessment, I don't think the world is going to change too much. And we can also, we can see some elements of that. The recent conflict that China and India had in the border can give some sense. And also don't forget that after the so-called Spanish flu, the last year of First World War, but after that we had the Second World War, where 66 million people died. So, if we look at history, it's very difficult to change human beings. So I'm not, there are a lot of people who say that the world will be different. I don't think there will be some changes here and there. Maybe on public health, there will be more attention, maybe. But the moment they get the vaccine out, they will come on the streets and celebrate and forget a lot of the things that we are going through now. Thank you very much.
So thank you very much. I'd now like to invite Poonam Yadav to make some comments to contribute to this discussion, please. Just think maybe you need to close your screen share, Imtiaz. Yeah, thank you. So Poonam, over to you, please.
Thank you, Peter, for the introduction, and thank you everyone for joining us today. I'm very pleased to be on this panel. In this short presentation, I'm going to bring this global problems to the local, very local, at home, and see how people have been experiencing this pandemic. Especially, we will look at it through a gender lens. So what I'm going to do now is to look at how gendered power relations and unequal social structures have impact on us during the times of pandemic. So our experience of any crisis is largely determined by the social structures we live in, The structural inequality between men, women, and sexual minorities has impact on how we experience a crisis. So, for instance, if you look at the Ebola outbreak of 2014 and 16, women were more likely to be infected by the virus due to their caretaking responsibilities and mostly being in the caregiving roles. If you also analyze Zika virus outbreak, you will find similar experiences. Women often do not have control over their own sexual and reproductive health. They have limited access to financial resources, which also means that dependency for accessing healthcare services. If we dig deeper into this, we'll find a lot of problems associated with the gender discriminatory structures. When I say structures, it means all kinds of structures: social structures, cultural structures, institutional, political, legal, and so forth. So the gender differential impacts of a pandemic are not a new thing. It's not a new find. It has always been there. It's well established and widely acknowledged. However, every time we are faced with the situation, it feels like we are starting it all over it again. Understanding how women, men, and sexual minorities are impacted differently during the global pandemics is fundamental, not only for better preparedness and response, but also for a long-term recovery. However, this is often missed or not taken into consideration in emergency preparedness and responses. Women and sexual minorities are certainly disproportionately impacted. However, it does not mean that gendered social structures do not have impacts on men. Now I'll share a couple of facts about the gendered impact of COVID-19. And later in the session, if we have time, I'll also discuss the current situation in Nepal due to COVID-19. So it's very normal to think that home is a safe place for everybody, and especially in crisis situations. Therefore, the government from around the world issued stay-at-home orders with immediate effect. However, if you look at the data, 243 million women and girls aged 15 and 49 have been subject to sexual and or physical violence perpetrated by their own partners in the past 12 months. 87,000 women were killed in 2017 only by their intimate partners or their family members. Stay-at-home orders from the government meant that women had to stay with their abusive partners, which increased the risk of violence and harm. Social isolation can also increase the risk of domestic abuse. Women in violent relationships are stuck at home and exposed to their abusive partners for a long period of time. If you dig deeper into just this one aspect of gendered consequences, you will see several interconnected problems. According to WHO, estimated 211 million women became pregnant each year, out of which 46 million pregnancy end in induced abortion. That's a clinical abortion. UNFPA estimates that for every 3 months of lockdown disruptions, between 13 to 51 million women who would otherwise have used modern contraceptives are unable to use it, resulting in 325,000 unintended pregnancies. And these unintended pregnancy would somehow end up, a large percentage end up in abortion. And you can imagine the developing world where they have lack of access to contraceptives. There is another really interesting fact is that 25% of the world's population still live in countries where abortion is highly restricted. You can start imagining the problems that this can create in the times of a pandemic. There was a news on BBC just yesterday about the lack of access to safe abortion services during the lockdown in India. And those which were available there were asking for a very, very high fee. So which also means that people cannot afford, and the pregnancy, unwanted pregnancy, often is resorted to unsafe abortion, leading to various health problems, including the death. Young women are disproportionately impacted, but also older women have different needs that needs special attention. And we already have talked about problems here in the UK in care homes. And the issues of women and girls with disabilities, problems faced by sexual minorities, all of these are overlooked, which had huge consequences, not just for women, but also for the whole family, society, and the nation. I'll end here. This is just my initial introduction, and I'll talk about the situation in Nepal later on when we go into the second round and during the Q&A. Thank you.
Thank you very much, Poonam. And now I'd like to ask our fourth panelist, Kwai Chang, to make a contribution to the discussion. Thank you, Kwai. Over to you.
Oh, okay. Hello, everyone. This is Kwai Chang. I'm greeting from Guangzhou, China. Thank you very much for inviting me to join the wonderful event. Now I will play a pre-recorded video first. Hello, everyone. Today, I will talk about my observations in China during the COVID-19 outbreak. The topic is about command and control in emergency response. Command and control are response mode with executive order as the core, which is mainly manifested as top-down resource coordination. Traditionally, top-down command and control methods have been seen to perform poorly in some emergency situations. For example, local resources cannot be adequately mobilized, and official resources are usually insufficient to meet demand. China used a top-down command and control method during COVID-19 outbreak, and it is effective in the following aspects. First of all, the infection and death rates remain relatively low in China after Wuhan's lockdown. Secondly, regions outside of Hubei have begun to resume work and production on a large scale around the date of March 20. How does China, a big country with a large population, manage to control the spread of virus from national level with a top-down approach? I would like to talk about 3 contributory factors that make the approach successful. First of all, the government took various measures to build universal consensus and public mobilization. The perception of new information is often influenced by how government and the media construct and relay the matter. We found that COVID-19 was officially and consistently described as follows. COVID-19 is a war without gunfire. Fighting to prevent and control the spread of COVID-19 is a people's war and requires every single individual effort. Controls of the spread of COVID-19 is the paramount priority for all people. This tone was set at a national level and consistently repeated at a local level and has established a quasi-wartime mechanism which ensures that the coercive power of the state can be maximized. This discourse of the prevention and control of COVID-19 as a top priority did not serve as a rouser on attention, indicating that the whole country had moved from state of normalcy to a state of emergency. It has also forged a sense of emergency in which the government will resort to unconventional ways to mobilize resources. Secondly, China has an entrenched and deep-rooted administrative system prior to the disaster. The administrative system goes deep down into grassroots level. This greatly helped the implementation of coercive force. Due to the accountability system in the governing structure, the effectiveness of epidemic prevention and control has become a major indicator on assessing the performance of the local officers. If the local government failed to follow the central government's instructions, for example, delay in information delivery, or fail to strictly control the epidemic, the local principal officers will be penalized. As such, local officers will maximize the mobilization of local resources for epidemic prevention and control. For example, in both urban and rural communities and villages, screening and surveillance of virus outbreaks are often government-led. Suspected cases are closely monitored, and temperature checks are also required at exits and entry in every small local community. Meanwhile, on the deep-seated administrative system, vulnerable groups at grassroots level would also be taken care of. For example, in institutions such as nursing home, fully closed management practice and 24-hour emergency duty system were implemented as control measures to prohibit free access. Every single person within the institution are required to undergo an epidemiological survey and at least twice viral tests to ensure that risk of virus spread are minimized. The implementation of such all-round measures requires deployment of substantial resources from the government and also mobilization of NGOs, enterprises, and for participation of the general public. The unified ideology of Chinese culture reduces the cost of control, coordination, and incentives, and eases the tension between the state and people when facing conflict. The unified ideology and the collective values that deeply punctuate in Chinese culture are manifested readily in the state of emergency, where Chinese people are more likely to put the overall interest of the nation first by ceding part of their individual interests or rights, such as a certain range of freedom and privacy. Taking the use of health code as an example, this health code is a small program on smartphones that allows individuals to authenticate their real names and report their health status. Its main function is to keep track of the places that a person has visited in the last 40 days and to verify if a person has been exposed to an area of high risk. This tool enables people in most parts of the country to return to normal life and production, while the epidemic has not been 100% controlled. Although this results in losing a certain range of privacy, most people are receptive to the use of the health code, and is now being running smoothly with very few resistance from the public. In summary, in China, command and control can be effective mainly because of three conditions: sufficient coercive force, universal mobilization, and social cohesion. Thank you for listening. Okay, that's all. Thank you. Thank you.
Just want to thank very much our four panelists. And sort of, I think before sort of opening it up to the audience, I just wanted to sort of drill down a little bit more on some of these themes of this discussion, and maybe picking up on command and control, and maybe a comparison about this. I mean, obviously quite remarkable, I think, what you said, Wei, about how the government took it upon itself to shield the vulnerable. And I feel this certainly initially this was quite different to the UK response, where the care homes were very much 20,000 care homes, most of them sort of privately owned and operated, were very much left to cope with things themselves. I mean, how actually did the government organize that in China? I mean, what sort of a legal authority did they have to impose lockdowns on care homes and do that sort of direction of shielding the vulnerable in the care homes? So did you get my question? Right.
Sorry.
Oh,
Sorry.
just asking, just commenting on how the central government imposed a lockdown on things like care homes, and just wonder how the government did that. What levers did the government use to shield the vulnerable in that way?
You mean is it legal to close the caring home?
No,
right?
not questioning its legality, but I mean, you know, just actually what was the mechanism for that? I mean, because, you know, in the UK there seem to be few levers to begin with, and they came later.
As I said, because it's a quasi wartime, so the government will use this mechanism to do everything they can to control the COVID-19, and so they have a very strict measures to the caring home. Yes, just to protect the old people. Yes.
Thank you. Maybe I just bring in David now. I mean, David, would you like to make a comparison on what happened, maybe both, say, in the UK and Italy, briefly on this shielding of the vulnerable in care homes, and the effectiveness of the government in doing it?
In Italy, it was the same mistake that Britain made, namely to discharge hospital patients into care homes without adequate testing to see whether they had the virus or were capable of spreading it, and without adequate precautions for staff and other residents in the care homes. That was fairly quickly put right, but by then the damage had been done. Care homes are not quite the same in Italy as they are in Britain, in as much as I think they use rather less agency staff. And one of the great problems in Britain was that agency staff would go from one care home to another, spreading the virus. Not that that was their fault. It was simply that the way that the system had become had gone like that. More generally, I'd like to say that I think to answer one or two questions that have come up in the chat, if I may, countries with a better welfare system, I would say, are more likely to do better against COVID. One thing you find that is rather curious is that welfare is never defined. Perhaps politicians are afraid to define it in case they should be held to account for failures or lack of welfare. But welfare really means looking after people in ways that they can't look after themselves in. Ensuring that we all have a minimum standard of care, whether or not we're capable of providing it for ourselves. Welfare has tended to flag in the West in recent decades with austerity and so on. And yet the most disciplined, the most cohesive societies and those with the best welfare appear to do best against COVID. And this perhaps is sending us a huge message to humanity about how we ought to be managing the risks that we face, not merely disease risks and not merely COVID in the future, and the importance of collectivity. If you look finally at countries like the US, where there is a tremendous emphasis on individualism and on so-called freedom, but the freedom of necessity is that we all have to collaborate in order to get the threats to each of us and to society under control. And that may go some of the way to explaining why US culture has not been effective at controlling the disease. Thank you.
Thank you, David. So just now, maybe want to turn to Poonam for a sort of bit of clarification on what she was saying, in that most countries imposed a lockdown to varying degrees, maybe some with more delay than others, but most countries imposed a lockdown. I mean, but in terms of how this had a gender impact, how it affected women, is it your case that the lockdown, intensified existing power inequalities, or actually we're seeing something quite different, which is actually going to be now quite hard to reverse, and actually we might see an entrenchment of more inequality because of the pandemic?
Thank you, Peter. I think because the country context is very different from the UK and Italy and China, so it might be necessary to just bring and give a little bit of background. So when this crisis started, Nepal was still recovering from its 10-year-long war, and thousands of people still remain displaced due to the war. People are still waiting to hear about the whereabouts of their loved ones who were disappeared during the war. Truth and Reconciliation Commission, which was established in 2015, has collected about 60,000 complaints, and they haven't dealt with. And then the country was hit by the devastating earthquake in 2015 that killed thousands and displaced millions of people. And there is this unstable government fighting between the political parties, and there is increasing gap between the rich and the poor, and uncontrollable number of migration and regular frequent event of disaster due to natural hazards. All of these had already left the country really weak in terms of managing any kind of crisis, did not have the capacity to manage any crisis. And this came. There was absolutely no planning. When we were just thinking about lockdown, and we were thinking about why are we not going to lockdown here, what the government is doing, in Nepal, the foreign minister were promoting Nepal as Visit Nepal 2020. Nepal is a corona-free country. Come here, you are welcome. And so that kind of stupidity what was going on, and people were laughing about it. Nepal went into lockdown on the 24th of March, when around the similar time when other countries were going to, which was a good decision. But at that time, there was no COVID cases at all recorded in Kathmandu. But then this created so much fear. So there was, because of no coordination, no planning, no information from the government, created lots of uncertainty among people and huge fear. And because of the fear, people did not know what to do. The government went into 1 week of lockdown, increased to 3 weeks. And by the time it went into the third phase of lockdown, people did not know what to do. So they started leaving Kathmandu. Many people come to Kathmandu, which is a capital city, from various parts of Nepal. They started living on foot by walking for miles, and many people died, including those people who were walking home, including women and children. Likewise, people were coming back from India. Around 2 million people work in India. They go to India for work, and they were coming. So the government, there was a confusion between the three levels of government that is there now. So central level, provincial level, and local level. So the disaster management and providing relief became the responsibility of the local government. And local government, because of the lack of information, lack of capacity of the local leaders, they were fearful, and they did not let the people who were coming back from India to Nepal, and they were stuck at the border. And later on, when they were let in, they were put in a quarantine place, which was often a school building with no toilet, any facility. And there were people dying in the quarantine facility, including a 16-year-old boy. There was a rape case in this quarantine facility. There are total 16,719 COVID cases recorded so far. 38 people have died so far. This is not the exact number. There may be more because there is no testing. And the Prime Minister said Nepali people are very much immune to COVID, and so we don't need to worry. We just have like some kind of herbal tea, and that will cure. So they even stopped testing. So we really don't know exactly how many people, but it definitely has a lot of impact on women, and it has exacerbated already existing inequality between men and women. Lockdown means working from home. Working from home means men working, women cooking and cleaning and doing, so added work responsibilities. Working women had to do both at the same time, and there is an increase in suicide. For instance, in first 74 days of the lockdown, 1,227 people committed suicide. There are problems associated, and many people could not seek and go to hospital during their pregnancy and for delivery, and people were dying. So there are many those kinds of problems, which I'll be able to highlight later on in the Q&A. But what I would like to say is that definitely the lockdown, uncertainty from the government, and has created and exacerbated the already existing gender inequality in Nepal.
Okay, thank you very much, Poonam. Really interesting to understand a little bit more about what is going on in Nepal. Imtiaz, I just wanted to come back to you and ask you about this point about the insularity, maybe driven by populist type governments. I mean, can you see that there had been a different sort of response? I mean, for instance, in South Asia, could there have been more regional cooperation? I mean, how would you see this? How could this have panned out better, do you think?
Yeah, thank you. No, as I was saying that, the right-wing governments or populist governments, made a difference this time to the pandemic. If there were other kinds of government, I believe things would have been much different, because what you needed, if we take WHO, some of the things that they were saying in January, you needed a big summit way back in January, and then do the whatever that was required. In South Asia too, unfortunately, well, India has a big right-wing government, a very insular government, more interested in issues of domestic compulsions. They've gone back to what is known in South Asia as a two-nation theory. So I guess if Congress was there, my hunch is that they probably would have responded much better, because the whole government was structured in a way, at least in last few years, almost all the neighbors got alienated. Even Nepal got alienated. Nepal and India had good relationship at one point. When Pakistan was way out, they have a bad relation now with almost all the neighboring countries. And the whole SARC was not functioning. Now, one can blame Pakistan for that, one can blame India for that, but the very fact that SARC was not functioning. So when this pandemic came, and suddenly in March, Modi thought that all South Asia should meet. If you tell me personally, I think that was pathetic, because you need to do work much earlier. You need to think that some of the things may come. And it was almost to outsmart China, because China's influence in South Asia is also very big now. So unfortunately, as I said, if there was Congress, I believe things probably would have been different. If the Democrats were in power, if Obama was in power, or even in Britain, different kind of government probably would have made things different. Now, the point here is, all these countries that we're talking about who really suffered more than others had some time. Now take some of the other countries, just to give one or two examples. Vietnam, for example, is a neighboring country of China, but it's a huge success that they have done. But nobody was flagging Vietnam, how they were doing. They went for quarantine very early and very what you call systematic lockdown. Nobody was trying to get lessons from Vietnam, because for years Vietnam was dubbed as an authoritarian and a communist regime and all those things. So somehow this was an opportunity to take lessons. At the same time, if you look at Cuba, for example, again, relatively a success story. Even within India, there is a success story, and that is Kerala. But Kerala has a left government. So the point here is, you could have made a difference. If Vietnam, Kerala, Cuba can make a difference, I see no reason why other countries would not be able to make a difference. You did not make a difference because those who were in power did not care about it. You take Donald Trump, for example. Even now, he doesn't take care. He's opening the schools. He's more interested in the re-election. So then the answer is that each and every citizen ought to be empowered to understand who are we putting in power. because I don't think the world can afford a situation like this. But my contention is a simple one, that humans could have done better, could have done much more, given the science that we have, given the interaction that we now have, could have managed this much better, because there are some countries which have. So on that basis, one can easily say that it's not a case of hopelessness. It's not a case that, a virus that suddenly, was so dangerous that nobody could understand. I think our politics, our populism, winning election, becoming insular, the right-wing forces, all these made things really bad. So I hope the citizens will wake up and will see merit, that who are we putting, because you cannot live in a world where you will say only my country, my nation, my country, my people. I think those are the words one has to forget. And I think this pandemic provides this opportunity where you meet and interact with all and help each other. You can't have a world where you say, this is the best university, my university is the best, my system is the best. Then you are creating problems. You need to make all universities good. You need to make all people good. You have to have that mindset. And I guess the pandemic has given us this opportunity to think differently. But as I said, I don't think we are going to change much. Humans, is very difficult to change much. And the circles that I was trying to, point out, the personal, what you call the local, they have all politics. They have also the mindset. Our brain is not always fresh. They inherit a lot of fear and trauma of the past. But we need to work hard. And given that there are good examples, I think I will say I'm still hopeful that somehow we'll manage this in a better way in coming days. Let's see.
Okay, thank you very much. We've got quite a few questions coming in through the Q&A chat facility. But first of all, I did offer to the panelists that if they had questions to each other, to have an opportunity now to express them. Kwai, did you have a question for your panelists? Any?
So I was just reading the questions from the Q&A, and I think I want to ask Yadav, right?
Yes, yeah.
Could you give us more details about the women? How does the COVID-19 impact on women in your country? Thank you.
Should I answer the question, Peter, now?
Yes, please do. Yeah.
Yeah. So thank you. Thank you. That's a very good question. So when we talk about women, we tend to put everybody into one basket, but that's not the case. So working women have different problems to those living in the remote rural villages who have never been to school, no education, no access to mobile phone or any sorts of information. So as I said earlier, this COVID-19 created a lot of huge fear among people. Fear was much more than the virus itself, we can say that. And if you look at the data, there are many people dying in quarantine facilities than actually from the COVID cases. Just to give you some idea and hint about the extent of the problem that women are facing in Nepal, there was a study carried out by a kind of survey carried out by an organization, an NGO called OREC, WOREC, in between 5 and 28th of May, with 334 women, which revealed that half of these 334 women said they have experienced violence during the lockdown. And when I present this data, I would like to mention that not everybody in Nepal has access to, especially women have access to internet and are able to use all of these technology, because the literacy rate in Nepal, in certain part of Nepal, among women is below 40%. I also conducted 2 webinars with various leaders in Nepal. So one was with the local women politicians who were in the front line supporting the people in this crisis, and these women were facing problems. So all the money would stay with the mayor and they would not give any money to all of the deputy mayors. So in Nepal, between the 2 leadership positions in the local government, you have mayor and you have deputy mayor. 98% of the deputy mayor are women. And so most of the money stays with the mayor, and deputy mayor did not have access to the resources even when they wanted to support. So this COVID has not just impacted women staying at home, women who do not have access to resources because they don't have education and so forth, but also women, those who are in the power, those who are in service providers. So there was one speaker who is now head of the only maternity hospital in Nepal, in Kathmandu. She also was sharing her own experience, how difficult it was for her to prioritize women's issues during this lockdown. So she wanted to keep running the pregnancy and delivery ward, but she was isolated and she faced a lot of difficulty arguing her case. So if we categorize people into different categories, they have been experienced different kinds of gendered and gender-based violence during this crisis. Rape and sexual violence by their own family members or neighbors also have increased, and these are big things that gets highlighted, but there are many subtle impacts which are invisible. People do not report because of the social and cultural structure. Women are not supposed to talk about what happens at home, so they don't talk about it. So there are very hidden problems that are not even out to the knowledge of the public knowledge.
Okay, yes, thank you very much. I just want to ask, do any of the other panelists want to ask the panel questions before we open it up? We've got quite a few questions coming in through the Q&A. Maybe we should go over some of these Q&A questions now. I hope the panel can all see the Q&As, but I'll just pick up a few, but obviously do feel free to pick up other things that interest you. I mean, and one is, quite a general one from Rosanna. The idea that the pandemic has made clear the importance of global leadership in pandemic management. I think, obviously something Imtiaz has been alluding to, but other things are also, I think that's an interesting point. That there are a number of questions about, there's quite a lot of interest in China's response. For instance, effective communication in educating the community, also about how social workers and volunteers responded in China in the emergency. And then we've got other ones, comparing also, again, looking at the shielding of the vulnerable. The UK, of course, is mentioned. So maybe we can just pick up a couple of those themes then. First of all, the idea of the international, the global response, and also maybe more specifically some of the experiences of China and how they compare to things like shielding, for instance, in the UK or Italy. So I noticed David had his hand up, so I guess he probably wants to leap in there first. Okay, David, over to you.
Okay, unmuted. Yes, in terms of global leadership, I think if you look back over the last century, global leadership has ebbed and flowed. It's come and gone. We've had periods where things have come together. We've had periods where it has appeared to be in the interests of the leaders of countries to get together and to promote a more globalized approach to leadership, and periods where there has been retreat from that. Of course, one of the defining characteristics of the COVID emergency has been a retreat into identity politics and into nationalism against internationalism. That is a very great shame, because the great lesson of the previous SARS outbreak was that internationalism was the key to solving the problem. If we simply marginalize and retreat from the World Health Organization, it may have its defects, but it is absolutely essential to the control of all major communicable diseases in the world, and we cannot do without it. So current developments are particularly worrying in that respect, and we need more internationalism of the kind that is therapeutic. If I could just add one thing by skipping from the global to an entirely different scale, a couple of questions were about people with disabilities. I'm very interested in this because I've just started a small project to survey and look into the case of people with disabilities in the COVID situation. One thing we note from that is that pre-existing inequalities and problems of enabling them and giving them a voice and so on have been exacerbated, worsened by COVID. And things like lockdown have been particularly difficult for them. They've suffered particularly, especially those people who require rather particular environments. For example, being able to go out in order to control their disabilities. And I'm speaking here particularly about people with mental or cognitive disabilities and some people with physical disabilities who need to exercise. So in fact, there has been disproportionate suffering, and there's no doubt about this, among people with disabilities who constitute 16% roughly of the world population, and that is not a negligible amount. Thank you.
Thank you. Hui, I just wanted to pick up on some of these specific China comments about the most effective education used in educating the community about COVID-19 in China, and also about the role of social workers and volunteers in China in the emergency.
Okay, I was just thinking about the two questions. The first is the most effective communication way, right? So I think during the COVID-19 outbreak, we use many ways to do risk communication and also the crisis communication. So I think the most efficient way for the communication is we use a small program on the smartphone. Let me show you. So you can, as long as you use the smartphone, you can see the confirmed cases. Confirmed cases, and also the confirmed cases around your area, and you could see if your area is a high-risk area. And I think this kind of way help people a lot. And we use a kind of crowdsourcing method to teach people how many people around you maybe how many confirmed cases around you, and you should take you should take what kind of actions. And this is for the first question. And the second question is for the social workers. What did social workers and the volunteers do during the COVID-19 outbreak? And as far as I know, they did lots of things for the community. First of all, they help to deliver the food and the suppliers for the lockdown community. Some communities are high-risk communities, so the community itself was locked down. So the volunteers and social workers help them to deliver the food for the families. And the second, they did a lot of emotional. They built emotional resilience in the residents. For example, there is a lot of hotline during the COVID-19 outbreak, and if people feel anxious or feel panic, they can call the hotline, and the volunteers will talk with them. So that's the second one. And the third one is that they help to do the temperature monitoring for the residents. That's all. Thank you.
Okay, thank you very much. Just sort of open this up now to questions. Anybody can jump in here, even though it's obviously, in a sense, directed at the gendered nature of the response. Amina Mohsin said, so we get back to hypermasculine states and nationalism. What happens to human rights and what role civil society can play when we give them the security lens that this is viewed through? I think obviously an interesting point about that. And also, I mean, somewhat related, Shamrita Zalman asks about, how does the research community view women leaders of the response to COVID-19? Obviously, quite a number of countries have had a female leadership in the response. So to whoever wants to pick that up.
I can start if you don't mind. Yeah, I mean, to Professor Amina's question, it may look like there is a rise of hyper-masculine nationalistic governments by the look of it, and by how things are going at the moment, and how things are being politicized, and also the rise of ethno-nationalism. But I think it won't go for that long, and that's my personal belief. As anything else, there will be a change soon. If I'm speaking about the context in Nepal, people are speaking against it, and I really hope that the change will come soon. What would civil society do? Civil society should carry on and not get divided. In Nepal during the pandemic, now government should be focusing on COVID, but at the moment there are many issues going on, and things that are being talked about and taken over by are absolutely not relevant and not necessary at the moment, and that has divided the civil society organizations in Nepal. Clearly, the civil society organizations, and even including women's rights organizations, have been fighting each other instead of working together in this crisis. So civil society organizations have to stick together, work together, and carry on fighting for the things that they have been fighting for a long time. The other question about women being better responders, I agree with that completely. We have seen the countries led by women have been doing much better. In a very plain layperson's term, it is the multitasking skills that women have, if you don't mind me saying. But also, I mean, evidence from Nepal suggests that women have been doing and planning much better, even at the local level, than men. They have been working day and night. If you go and ask men leaders, they will say, oh, women can't go because of the cultural reasons, they can't go at night. But if you talk to women working together and 24/7. So definitely, I think involving women in disaster planning is already is definitely beneficial, and that should be the way forward. We are too late in doing that, and we should definitely put more focus into that.
Thank you. Did anybody else want to contribute to that discussion?
David wants.
David.
Thank you. I agree with Poonam. It is a pretty robust hypothesis that women are better emergency managers than men. That may be, if it is true, because they are more in the spotlight and they have to compete more, or it may be because they have innate abilities to do better. But I know of many instances in which women have managed crises and emergencies on behalf of populations in exemplary manner, not to imply that all women are better than all men, of course. There may be some statistical validity in that. Regarding populism, one of the problems with populist leaders is lack of rationality. One thing we need to be in COVID to manage it is supremely rational. There are about 11 different things in epidemiology, virology, medicine, and health that we don't properly know. This is an emerging disease with a new virus, and we need slowly to learn about its capability to infect, about who it infects the most, about how infective it is, or what the case fatality rate or lethality of it is, about how it can be brought under control, about what sort of immunity people can develop against it, about the prospect for a vaccine, about how long immunity might last. A series of things like this, which initially were not known at all. And now we're beginning to get a grasp of that, but it is a slow process. The management process that runs in parallel with the scientific endeavor has to adapt itself to the latest scientific information, which also has to be something that is a consensus among the scientific community, rather than rogue scientists or individuals saying, well, this might be the case, and everyone else then having to go and test out whether it is. So all of that requires a very rational approach. And what we tend to see with the populists is that they are anything but rational. They also tend to be very poor economic managers. We therefore see that the other half of this crisis, which is the economic crisis, keeping people in employment, keeping the economy going, is likely to be managed much worse in places where we have irrational leaders. Thank you.
Thank you, Dave. That actually sort of leads us into a question from Daniel Vieira, asking about how can disaster management work if high percentages of the population are basically anti-science. Anybody want to pick up on that? Imtiaz?
Yeah. I think the easy answer would be that you have to invest in the public sector. You have to invest in public health in a much bigger way, in education, even in higher education. And your higher education can't be insular. That's the other problem. You have higher education in different parts of the world with a concept called national education, which really doesn't make any sense. And particularly university, you call yourself university, but then you have all these restrictions. You're talking about universe, but it's a national university, which is a misnomer. So the point, I think, the pandemic provides this opportunity. There was one question was asked whether research and development, research and education is going to change. I think this is the big opportunity. In every risk, provides you an opportunity. And I think the opportunity is how you reformulate your education. I understand blaming some of the things is not going to take us very far. Understand one can critique, as I was trying to do with the right-wing forces, but the matter is people who actually voted them. So how do we go back to each and every person and empower them in a way where they will create a different kind of world? And I guess research and education probably would be one. And if we can get out of our own insularity, and I'm talking as an academician, if we can get out of our own insularity, if we can create courses which are global, create certificates which are global, and the technology, somehow has come in a hurriedly. It was almost coming. The classroom was becoming different in any way. Pandemic just made it quicker. I guess this is the opportunity to redesign and reinvent education globally. I think that's one of the way out to the queries that were made.
I just wonder if I could bring Hui in on this question. I mean, she's worked extensively in Japan and on Fukushima. And obviously, you know, the Fukushima disaster had a massive impact on the confidence of the Japanese public in science. I mean, how do you see these anti-science themes panning out in a sort of disaster management response to the pandemic? Are people still confident enough in science?
Yes, we can also observe this kind of phenomenon also in China and all of the world, the anti-science like phenomenon. I think this is normal, because I think scientists and the normal people they have a gap. They always have a gap between the scientists and the ordinary people, because ordinary people, they get limited information about very professional professional things. So I think it's a normal thing. Yes.
Thank you. I mean, I'd like to invite the panelists to come in and make their final comments soon. So I just want to pick up a couple of things. I mean, you know, we are, you know, talking about migration a bit later in this meeting, but I think it's just worth picking up this question about how does the United Nations, the European Union, you know, do they need to do more in Greece for the refugees? And again, this obviously links to what is happening now with the Rohingya in Bangladesh and Myanmar. And obviously we've just had the Disaster Emergency Council in the UK launch an appeal for this, I mean, with obviously an even sharper focus maybe on Yemen as well. So would any of the panel want to comment on this?
I think David wanted to say something.
Thank you. It actually related to the previous question, which was that we talked about science, but we didn't add pseudoscience. There are two overriding questions here. One is 5G, which is to say fifth generation cellular telephony. Does it cause COVID? Which it obviously doesn't. But that has been a much bigger thing than often we in science are willing to admit. And the other is anti-vaxxing, in other words, people who are against all forms of vaccination. And the situation is remarkably fluid with respect to both of these. It's proving very difficult to stamp out ideas. One thing about vaccination is we know it's got to happen, and it's got to happen comprehensively. And those who opt out of it pose a risk to the rest of society. At least they do in certain infective diseases, and we'll see whether that's the case in this one if a vaccine is provided. In terms of 5G telephony, every new generation of cellular telephony has led to this kind of thing. It is, however, very destructive, bearing in mind that emergency services might be dependent on it. And these are some issues. Turning though to the question of refugees, I think that fits in with the fact that there are disadvantaged groups and there is a need for welfare. We have been somewhat against welfare and in favor of individualism in the modern world under the impetus of unbounded capitalism, of populist leaders and so on. Instead, what we need is to go back to ideas of welfare and develop them in a modern way such that they are much more inclusive. And perhaps Black Lives Matter has been one of the movements that have indicated the need for much greater inclusiveness. Of course, that is a need that extends to refugees as well, very much so, because they may be in an extremely precarious position regarding infectiveness. And it is in the direct interest of society that refugees be looked after in this way. If, for example, well, there have been cases in Italy and in Greece of refugees leaving refugee camps and being COVID positive. So the best response to that is to provide better healthcare to refugees. and in fact better conditions generally, so that they're less likely to be bearers and carriers and victims of COVID-19. Thank you.
Thank you. I think I'd like now to just bring all the panelists back in for 2 minutes of closing comments and to pick up any questions they can see in the chat that they particularly would like to address. And so I think we'll just do this in reverse order. Hui first, then Poonam, then Imtiaz, and then David. Hui, do you want to spend 2 minutes just summarizing and picking up on any other points you want at this point?
Okay, from the practices seen in various countries, we noticed that the effectiveness of epidemic prevention and control not only depends on the severity of government intervention, but also on the natural variation in the occurrence of the epidemic itself. It may even reflect the influence from cultural differences of different ethnic groups in response to the COVID-19. China has adopted a command and control with a pan-participatory approach in response to COVID-19. And this is related to the country's political, historical, and cultural background. What works for China may not work for other countries, and vice versa. Personally, I think China's response measures are generally effective, but definitely with high cost. And this is tough to sustain such intensive measures for a long time. At the same time, this type of response during emergencies may also make local governments dependent on the central government, especially in less developed areas, and their ability to solve problems on their own will be reduced. Quasi-wartime mechanism thus increase the country's resilience to crisis in the short term. However, what about long-term impact? We also do not know in what ways has this approach to governance increased resilience, and in what ways has it reduced it. I personally feel that these issues require ongoing thought and research. And at last, I want to answer one question from the Q&A. It's about the African communities in Guangzhou. So I just did some research on this matter, so I think I have some information to share. The outbreak of the African community occurred in Guangzhou, where I'm in at the moment. Our research team has conducted a 1-month investigation on this issue. The fact is that Chinese did not include the residents of African countries as the objectives of the monitoring at early stage, because there wasn't any cases of COVID-19 in African countries at that time. This became a relatively big problem, resulting in more than 100 African residents were discovered to be infected afterwards. Therefore, major investigation and isolation of the African communities were initiated. In fact, such measure is the same as the one taken in Chinese communities, which is not as racial discrimination as the media says. That's all, thank you.
Thank you very much. Poonam, just 2 minutes, please, or even less than 2 minutes, running out of time.
I'll keep it very quick. So I'll just make 4 points. One is about when thinking about disaster risk reduction and planning, we need to think about local government as very dynamic and could change anytime. When I'm saying that, in Nepal, the new disaster risk reduction policy was introduced in 2017, which did not think about the Nepali governance structure, which changed significantly after that. And there is a lot of confusion now about whose role, the roles and responsibilities of different governments, and that has impact on current situation. Second, thinking about DRR, we need to think about it as holistic, not just think about COVID-19 as a health problem, but also socioeconomic and various other other consequences of it, and how we can address this holistically by bringing all the actors together. Third point is about thinking about impacts. We should always consider the gendered impacts of this kind of pandemic to various groups of people. Therefore, collecting gender disaggregated data is extremely important. And the final point is about thinking about the problems. Us as a researcher, we need to not only think about the big question that we always tend to get into, but also the smaller questions, the hidden questions, the invisible questions. There is a risk of all of us thinking about only bigger question. What we're doing is we are trying to do good, but instead we are doing harm, because some issues are become hyper visible and they get funding and so on and so forth. And there are other bigger issues in the local term, they don't get the visibility, and therefore that has consequence. So thinking about big question is important, but also thinking about smaller questions and local questions. Thank you.
Thank you very much. Imtiaz.
Very quickly, just let me flag two things. One is the relationship between science and faith is an old one. It's not going to go away. It's going to remain. The only thing is that those who are in the faith should not preach their faith as science, and neither science should see their science as something faith. That's all that you need to know. But you know, they have to live together. I don't think you can throw one or the other. Somehow that's what humans after all are also spiritual beings. You know, that's the point I'm trying to make. And the second thing is, if you listen to WHO and some of the scientific things that have been talked about pandemic, how you contain, it's not rocket science. It's very simple. They focus on three things: hand washing, wearing mask, and physical distance. You don't need ICBM or SLBMs to do that. You don't need a huge budget to do that. But for the three things to do, you need almost empowering each and every person. Because one person can infect more than 200 people. And there are cases after cases like that. So how do you bring our education, our ideas, our thinking absolutely to the point of a person? That's, I think, is the challenge. If you can empower, and I'm not talking about people, I'm not talking about local government institutions, those are, will take us in a different direction. Each and every person has to be empowered. And I think this pandemic has given us another opportunity to think differently as how we go about doing that.
Thank you very much. David, maybe just a minute, please. Mute David.
Okay, got it. Well, I'm going to waste a few seconds of it by saying that at a conference, I once met a rocket scientist and he told me it's not that difficult, but I'm not sure I believe him. Indeed, I definitely don't. Over the last, sorry, I'll start again. In 4 months' time, I will have been studying disasters for 40 years. And since COVID started, I feel as if my entire experience of disaster has flashed before my eyes, speeded up. It is amazing how many different things have come out of this, because it is, of course, so much more global than other things. We need political change. We need economic change. We need environmental change. But to do that, we need cultural change. Problem with cultural change is it is something that tends to occur slowly and is enormously intensive of effort. We see some abrupt cultural change, and it is quite amazing to look at, but we need very much to speed up the rate of cultural change, if that can be done, towards something that is more benign for the world we live in.
Okay, well, thank you very much. And I'd like to thank all our panelists for a really interesting discussion. We actually probably realized just touched the surface of scratched the surface of these issues, about a fascinating discussion. But I'd just like to say that we have our next session starting at 12 o'clock with Mark Gordon giving the keynote talk. And then there's just like you've got 10-minute break. The Zoom networking channel is open. So if you want to network while you grab a cup of tea, please join us there. Again, thank you very much to all our panelists, and thank you for the audience for a great set of questions. Thank you.
Thank you, Peter, and to all the panelists. To the audience, please remember you have to come back again in this particular platform for the keynote speech here, not in the networking platform, please. Okay, I will stop live streaming for 10 minutes and then please come back again here. Thank you. In 10 minutes, I will be back.